Introduction. Liver cirrhosis is a progressive and chronic disease that causes scarring and destruction to liver tissue. Long-term alcohol misuse, viral hepatitis infections, fatty liver disease, and autoimmune illnesses are all what can lead to this condition. With this condition, the liver's ability to function normally is compromised because scar tissue is gradually replacing healthy liver cells as the liver attempts to heal itself. Cirrhosis is becoming more common as a result of a number of reasons. Firstly, a significant proportion of instances of cirrhosis can be attributed to the rise in excessive alcohol intake in many nations. Alcohol-related cirrhosis is a major health problem because excessive alcohol consumption damages the liver over time. Cirrhosis can also be the end result of chronic hepatitis, which is common due to the prevalence of viral hepatitis infections that often go undiagnosed or mismanaged. Despite advancements in vaccine and treatment, hepatitis continues to be a major cause of cirrhosis. Cirrhosis is on the rise worldwide, and one of the causes is the prevalence of non-alcoholic fatty liver disease, NAFLD. Sadly, NAFLD is on the rise alongside obesity, poor diet, and lack of exercise in today's society. If liver fat accumulation isn't managed, it can lead to inflammation, fibrosis, and cirrhosis. Liver failure, hypertension, and an increased risk of liver cancer are all serious problems that can arise from cirrhosis. There is a heavy social and emotional cost associated with liver cirrhosis. Because of the disease's symptoms and effects, patients often have a lower quality of life and find it difficult to do routine tasks. When a loved one has cirrhosis, not only do they suffer, but so do their family members who are there to help them through it. Cirrhosis can put a significant financial burden on healthcare systems worldwide due to the difficulties, hospitalizations, and treatments it necessitates. The fact that cirrhosis may have moderate or non-existent symptoms in its early stages is a major problem. If liver damage isn't identified until it's too late, treatment may not be able to save the patient. Early detection and prevention can be greatly aided by routine health screenings, especially for those who have risk factors including alcohol use, obesity, or viral hepatitis. In the chapters ahead, we will look at all you need to know to prevent and manage this condition. Chapter 1. A brief introduction to the liver. The liver is one of the body's most important organs due to its many functions. The liver, located just below the diaphragm, is a busy nerve center that keeps the body going. A wide range of metabolic processes in the body are performed by the liver. The liver's regulatory prowess extends to all macronutrients, including carbohydrates, proteins, and lipids. Glucose, a kind of sugar necessary for energy, is processed and stored by the liver after a meal. The liver releases glycogen back into the circulation as blood glucose levels drop, helping to maintain steady blood sugar levels. The liver is in charge of keeping an eye on proteins, which are essential to life. By synthesizing, degrading, and transforming proteins in this organ, a healthy amino acid balance is maintained. The liver also metabolizes meals and stored fats to make essential chemicals like cholesterol. The liver also plays a crucial function in detoxification. The liver acts as the body's gatekeeper, filtering and neutralizing potentially dangerous compounds taken in through diet, drink, medication, or environmental exposures. The liver protects the body from potential harm by transforming poisonous molecules into less dangerous substances. The liver uses a two-step process to purge toxins from the body. Enzymes perform the first phase intermediate metabolite conversion from potentially hazardous chemicals. Phase 2 involves additional processing and conjugation with molecules like glutathione or sulfate to make these intermediates water-soluble and excretable via bile or urine. The liver's role in digestion is also crucial. Bile is a byproduct of the liver's breakdown of fats and is stored in the gallbladder for later use. When we eat fatty foods, the gallbladder secretes bile into the small intestine, where it emulsifies the fats and makes it easier for enzymes to digest them. The liver is also involved in the absorption of fat-soluble vitamins, A, D, E, and K, which are crucial for a wide range of functions like eyesight, immunity, bone health, and blood coagulation. The liver plays a vital role in sustaining and maintaining our health and well-being by facilitating metabolism, cleansing, and digesting. The liver's interconnectivity in maintaining metabolic balance is further illustrated by the fact that its metabolic processes are intimately linked to those of other organs like the pancreas and the adrenal glands, which secrete hormones that regulate glucose levels. The liver also plays a crucial role in regulating and storing different nutrients. Excess glucose is stored as glycogen and made readily available when the body's energy reserves are low. This is especially useful during fasting or strenuous physical exercise, as it guarantees a constant flow of energy. The liver also synthesizes blood-clotting proteins that are vital to the body's survival. In response to trauma, the liver rapidly produces clotting factors that aid in the production of blood clots, stopping excessive bleeding and accelerating wound healing. The liver's extraordinary regenerative capacity allows it to mend and recover from damage brought on by infections, poisons, or particular disorders. However, severe or prolonged damage can result in conditions like hepatitis, cirrhosis, or fatty liver disease, all of which diminish the liver's ability to function and pose a threat to the body as a whole. The liver's incredible regenerating capabilities don't make it immune to harm, either. The liver's capacity to function efficiently can be compromised by things like excessive alcohol intake, drug abuse, bad diets, and obesity. Therefore, protecting this organ requires keeping to a healthy and balanced lifestyle. There are numerous dietary and behavioral modifications one can make to protect the liver. Firstly, it's very important to eat well. The liver in general health can benefit greatly from a diet that is high in nutritious foods such as fruits, vegetables, whole grains, and lean proteins. The liver benefits greatly from regular physical activity. Maintaining a healthy weight, decreasing the likelihood of developing fatty liver disease, and improving the efficiency of the liver's metabolic activities are all aided by a regular exercise routine. The liver benefits greatly from avoiding excessive alcohol consumption. Chronic alcohol misuse can cause liver inflammation and scarring, which can eventually lead to cirrhosis or liver failure, since the liver processes alcohol. Moderation in alcohol consumption is recommended for individuals who can't do without alcohol. Keeping yourself hydrated is also crucial. Consuming sufficient quantities of water aids the liver's detoxification activities by facilitating the elimination of metabolic waste and toxins. Stress reduction has positive effects on liver function. The liver's ability to process toxins and hormones is negatively impacted by prolonged exposure to stress. Stress can be reduced via the practice of relaxation practices like yoga, meditation, or simply spending time in nature. Checkups and tests should be performed routinely in order to discover liver problems at an early stage. Protecting the liver requires that dangerous drugs be avoided. Pollutants in the environment, chemicals, and poisons in some prescription and recreational substances should all be avoided wherever possible. The regenerative abilities of the liver. The liver has the remarkable ability to heal itself and recover its functionality after damage, whether from infection, toxins, or even surgery. The basic cells that make up the liver, called hepatocytes, are responsible for this extraordinary quality. These hepatocytes can divide and multiply to replenish damaged liver cells and restore the organ's normal shape and function after it has been injured. When the liver is damaged, the death or injury of liver cells sets off a chain reaction of biological events that causes the surrounding hepatocytes to begin quickly replicating. Hepatic stellate cells and Kupffer cells are examples of non-parenchymal cells that aid in liver regeneration by secreting cytokines and growth factors. To make up for the missing cells, the liver temporarily enters a hypertrophic phase during regeneration, during which the surviving hepatocytes swell and their metabolic activity increase. In time, the newly produced hepatocytes will blend in with the rest of the liver's tissue, bringing back the organ's normal structure and function. Despite the liver's impressive regenerating capabilities, it's important to remember that the organ has its limits. Severe or sustained injury can result in chronic liver disorders and scarring, a condition known as cirrhosis. The ability of the liver to regenerate has important medical consequences, especially when considering liver transplantation or surgery. Patients with severe liver damage or sudden liver failure may benefit greatly from a liver transplant. Because the liver is capable of regeneration, it is possible to do partial liver transplantation, in which a living donor gives a portion of their liver to a recipient. After some time has passed, both the donor's and recipient's livers will have recovered to nearly full capacity. This lessens the dangers of transplantation and increases the supply of organs for those in need. It is essential to stress the relevance of maintaining a healthy lifestyle despite the liver's resilience. Non-alcoholic fatty liver disease, NAFLD, and viral hepatitis are two examples of chronic liver illnesses that can cause long-term damage that may eventually exceed the liver's ability to recover. Prevention of liver damage and preservation of its regenerative capacity necessitates a healthy lifestyle. Chapter 2. Introduction to Cirrhosis. Cirrhosis is a persistent and permanent scarring of liver tissue that leads to chronic liver disease. Cirrhosis's pathophysiology is complicated, as many different systems work together to cause scar tissue to grow in the liver. The first step is liver injury, which can be brought on by things like drinking excessively over a long period of time, contracting a virus that infects the liver, such hepatitis B or C, developing NAFLD, having an autoimmune disorder, or using certain drugs. The liver initiates a self-repair process, known as regeneration, in response to damage. However, the liver's regenerating capacity can be overwhelmed by recurrent damage, resulting in the creation of fibrous scar tissue. Damage to the liver causes inflammation, and immune cells are called to the location where liver cells, hepatocytes, have been hurt. In addition to contributing to liver cell injury and inflammation, the release of inflammatory mediators from these immune cells, such as cytokines and chemokines, also plays a role. In reaction to liver damage, the vitamin A-storing stellate cells of the liver become activated. When stimulated, stellate cells undergo a metamorphosis into myofibroblasts, which are responsible for the overproduction of collagen and other ECM proteins. ECM accumulation causes liver architectural disruption and impaired function. The growth of scar tissue in the liver interferes with the normal delivery of oxygen and nutrients to the organ, as well as the removal of waste products. Portal hypertension, or elevated pressure inside the portal vein system, can develop as a result of decreased blood flow. In response, the body grows new blood arteries called collaterals to avoid the liver and reduce portal hypertension. Both the esophagus, esophageal varices, and the stomach, gastrovarices, can have such collaterals, and both are extremely dangerous due to their propensity to bleed. The liver experiences structural alterations, taking on a nodular and uneven appearance as scar tissue accumulates. Fibrous bands encircle nodules of regenerating hepatocytes, severely impairing the liver's capacity to detoxify chemicals and create proteins. As the liver's ability to filter blood pollutants and metabolic waste decreases, it can cause a number of systemic problems. Hepatic encephalopathy, brain fog, coagulopathy, blood clotting problems, hypoalbuminemia, low albumin levels, and a weakened immune system can all contribute to these symptoms. Liver scarring progresses, and the condition can become irreversible if the underlying cause of cirrhosis is not treated successfully, eventually leading to liver failure. Liver transplantation is sometimes the last hope for patients with end-stage liver disease. The severity of cirrhosis symptoms and problems increases as the liver's ability to function deteriorates progressively. Jaundice, a yellowing of the skin and eyes, ascites, a buildup of fluid in the belly, weariness, weakness, and easy bruising and bleeding are all common symptoms of severe cirrhosis. Abdominal and limb swelling result from decreased albumin production when the liver's synthetic function deteriorates. In severe circumstances, bleeding tendencies caused by the decreased generation of clotting factors might be fatal. Coma and other severe mental symptoms are possible outcomes of hepatic encephalopathy. When the liver isn't able to process toxins efficiently, they accumulate in the blood and have an adverse influence on brain function. The occurrence of hepatocellular carcinoma, HCC, a kind of liver cancer, is an additional serious outcome of cirrhosis. The liver's constant state of regeneration and inflammation fosters the growth of malignant cells. Hepatorenal syndrome is a life-threatening condition that can develop as a result of cirrhosis. Acute kidney damage develops as a result of compromised blood flow and elevated pressure in the portal vein system. When dealing with cirrhosis, it's important to treat both the disease itself and any complications that may arise as a result of it. For instance, if alcohol addiction is the root cause of cirrhosis, abstaining from alcohol is critical for preserving liver function. Medications are an option for managing inflammation and slowing the progression of fibrosis. To treat fluid retention, diuretics are prescribed, and in severe cases, a paracentesis is performed to remove fluid from the abdominal cavity. The most effective treatment for severe cirrhosis and liver failure is a liver transplant. The damaged liver is replaced with a healthy one from a deceased or living donor. However, there is a shortage of donor organs, and not everyone is eligible for a transplant. Patients with cirrhosis need constant medical supervision to prevent and treat the many complications that can emerge as the disease worsens. Monitoring liver function is very important. Liver function is measured by measuring bilirubin and other bile acids in the blood. Liver size, nodularity, and tumor presence can be assessed with imaging techniques like ultrasonography, CT scans, or MRI. Malnutrition can also impair liver function. Therefore, nutritional support is crucial for those with cirrhosis. Most experts advise eating a diet high in protein and fiber and low in salt. When a patient has severe malnutrition, a nutritionist may work with them to create a special diet. Beta blockers, for example, can be used to lower blood pressure in the portal vein system and so lessen the risk of bleeding in patients with esophageal varices and other problems. Ammonia-lowering drugs like lactulose and rifaximin are useful in the treatment of hepatic encephalopathy. Some people find relief by reducing the amount of protein they eat. Diuretics are routinely prescribed to people with ascites in an effort to alleviate their symptoms. Therapeutic paracentesis, in which fluid is evacuated from the abdomen, can provide relief in more severe cases. Disease management relies on identifying and treating the underlying cause of cirrhosis. Lifestyle adjustments, including weight loss and increased physical exercise, are indicated for those with non-alcoholic fatty liver disease. Antiviral medicines are used to treat hepatitis B and C infections. When all other treatments have failed, liver transplantation is the only option for patients with advanced cirrhosis and liver failure. Factors including the recipient's general health, the availability of a suitable donor organ, and good post-transplant care all contribute to whether or not a liver transplant would be successful. Causes of cirrhosis. Cirrhosis is commonly associated with long-term alcohol usage. Consistent heavy drinking over many years places a heavy burden on the liver, which is responsible for metabolizing alcoholic beverages. This procedure produces inflammatory and cell-damaging byproducts that are harmful to the liver. Fibrosis, in which scar tissue gradually replaces healthy liver tissue, can occur as a result of chronic alcohol-related inflammation. Cirrhosis is also commonly caused by chronic viral hepatitis, particularly infamous for their capacity to infect the liver and produce persistent inflammation are hepatitis B, C, and D. The liver goes through a repair phase in response to the chronic inflammatory response, which might result in fibrosis. Cirrhosis, which affects the liver's capacity to function, can develop if this fibrosis is not treated or managed properly. Lifestyle and diet play a significant role in the development of non-alcoholic fatty liver disease. Caused by obesity, insulin resistance, or abnormally high blood fat levels. This condition manifests itself when fat accumulates in the liver cells. Non-alcoholic fatty liver disease has the potential to develop into non-alcoholic steatohepatitis, NASH, which is characterized by increased inflammation and liver cell destruction. If the inflammation caused by NASH is not treated, it will lead to fibrosis and eventually cirrhosis. Cirrhosis can also be brought on by autoimmune illnesses. The body's immune system can mistakenly attack healthy liver cells. Hemochromatosis, excess iron accumulation in the liver, Wilson's disease, copper accumulation, and alpha-1 antitrypsin deficiency, a protein shortage affecting the liver and lungs, are all examples of rare, inherited metabolic disorders that can lead to cirrhosis. Cirrhosis can also be caused by chronic conditions like cystic fibrosis or by drugs that are toxic to the liver. The level of liver damage caused by cirrhosis varies from person to person, depending on factors such as genetic susceptibility, overall health, and the duration and severity of the underlying cause. The progression of cirrhosis can be slowed down and the prognosis improved by identifying the underlying causes early and treating them appropriately. Populations most likely to develop cirrhosis. Cirrhosis is more common in certain populations because of shared genetic, environmental, and behavioral risk factors. Due to variations in alcohol consumption patterns and hormonal factors, Men have traditionally been found to be at a higher risk than women. The margin used to be much larger, but shifting drinking patterns have helped close the gap in recent years. Some racial and ethnic groups are more likely to contract specific types of viral hepatitis, which can lead to a higher risk of cirrhosis. Hepatitis B infection, for example, can be more common in people of Asian or African origin. Due to the cumulative effect of chronic liver injury over time, age is a crucial factor in the development of cirrhosis. Age-related liver impairment may put older adults at greater risk, but those who have a history of severe alcohol use or virus infections in childhood are also at risk. Because people of lower socioeconomic class are more likely to lack access to quality medical treatment, nutritious food, and protective environments, their risk of developing cirrhosis is higher. The likelihood of getting cirrhosis is also greatly impacted by one's way of life. Because of its negative effects on the liver's function and metabolism, smoking, for instance, has been linked to an increased risk of liver disease, including cirrhosis. There is some evidence that people with a genetic predisposition to liver problems or a family history of liver disease are more likely to develop cirrhosis than those without such a history or traditional risk factors. The development of a disease can be affected by one's genes in ways that affect the liver's ability to detoxify substances and heal after injury. It's worth noting that some people may have many risk factors that make them more likely to develop cirrhosis. Those who have two risk factors, such as heavy drinking and chronic hepatitis B infection, are at a substantially higher risk than those who have only one. Cirrhosis is easier to treat if caught in its early stages. Thus, it's important to check for liver illnesses often, especially in high-risk individuals. Healthcare providers have a vital role to play in reducing the prevalence of cirrhosis by informing patients about preventable risk factors. Chapter 3. First signs of cirrhosis. Tiredness is an early indicator of the disease. Patients may experience a lack of energy and fatigue despite enough rest. Weakness and weariness are common symptoms of liver disease because the liver becomes less effective at filtering out toxins and making vital proteins. Weight loss or a lack of appetite is another early sign. The liver is essential for breaking down food and absorbing nutrients. When this function is compromised, patients may lose their appetite and their weight gradually and unintentionally. Cirrhosis patients may see an increase in their propensity to bruise and bleed as their condition worsens. Clotting factors are produced by the liver to help regulate bleeding, but if the liver is injured, clotting may be compromised, leading to easy bruising and persistent bleeding from even slight injuries. The skin and eyes turning yellow, jaundice, is another early sign of cirrhosis. This yellowing of the skin and eyes occurs when the liver is unable to filter bilirubin, a pigment produced during the normal breakdown of red blood cells. Cirrhosis can alter the abdomen's look in obvious ways. Ascites is a disorder in which fluid accumulates in the abdominal cavity. Hepatic encephalopathy, a disorder characterized by disorientation, trouble concentrating, and poor cognitive function, can develop if the liver continues to decline. An accumulation of chemicals in the brain results from the damaged liver's inability to filter poisons properly. Early symptoms of cirrhosis are often vague and easily misdiagnosed. Itchy skin, for example, can be a symptom of the liver's diminished capacity to filter toxins and waste product from the bloodstream. Cirrhosis worsens over time, increasing the risk of death through internal bleeding, hepatic coma, if it is not treated. When cirrhosis progresses, spider angiomas or spider nevi, skin growths that resemble spider webs, may occur. These form when the blood pressure in the liver's vessels rises and serve as a visual sign of vascular alterations. Abnormalities in liver function may also show up in diagnostic blood testing. Acute or chronic liver injury or inflammation can cause an increase in alanine transaminase, ALT, and aspartate transaminase, AST, levels in the liver. Albumin, a protein made in the liver, may also be discovered at lower levels in blood tests if the liver's ability to synthesize proteins is impaired. You should not put off seeing a doctor if you notice any of these warning symptoms or have any other concerns regarding your liver health. Severe signs of cirrhosis. Portal hypertension is one of the most serious consequences because it causes pressure to build up inside the portal vein, the main blood artery that supplies the liver. Veins in the esophagus and stomach can become swollen and unstable due to the pressure, This condition is known as varicose veins. Ruptured varices can cause severe bleeding that could be fatal. Hepatic encephalopathy is another life-threatening condition that may have been highlighted in the early symptoms. Ammonia and other pollutants build up in the bloodstream because the liver cannot process them efficiently in people with severe cirrhosis. In extreme circumstances, hepatic coma can result from exposure to these poisons, which can also cause confusion and behavioral abnormalities. As the disease progresses, the symptoms of ascites, fluid accumulation in the abdominal cavity, may become more severe. A person with ascites may have trouble breathing since the condition can further reduce lung function. Drug poisoning may also occur because the liver's ability to metabolize medicines is diminished in cirrhosis. This necessitates vigilant monitoring and possible dosage adjustments throughout medical therapy for a variety of illnesses. Increased susceptibility to insulin resistance and type 2 diabetes can result from cirrhosis's effects on the body's capacity to regulate glucose levels. In the last stages of cirrhosis, the liver's ability to regenerate and function is severely impaired. Some people may reach the point of irreversible liver failure, making a liver transplant their last hope for survival. It's crucial to keep in mind that cirrhosis might worsen over time and eventually prove fatal. Therefore, people who know they are at risk should take precautions, get frequent checkups, and follow the advice of their healthcare providers. The development of these symptoms as the disease progresses. As the disease progresses, the symptoms typically get more severe and change over time, having a more negative effect on the affected person's quality of life. The symptoms may be mild and easy to ignore at first, but they will grow increasingly obvious and difficult to deny over time. Some mild discomfort or a slight drop in overall performance is possible in the early stages. These annoyances intensify and occur more frequently as the disease advances. A patient with a chronic condition may begin to feel minor pain or exhaustion on occasion. The longer the symptoms last, the more likely it is that they will start to get in the way of the affected person's regular routine. Fatigue and pain may become more persistent and difficult to control. The condition can become much more complicated if additional symptoms appear. As the disease progresses, the symptoms manifest in more and more areas of the patient's life. Problems with movement and daily activities may arise as a result of physical complaints. At the same time, mood swings, memory loss, and inability to focus could also become frequent. If left untreated, the symptoms can worsen to the point that the affected person can no longer care for themselves. In order to properly manage their symptoms, they may need more frequent medical treatments or specialized care. When the disease progresses, the symptoms can become chronic and resistant to therapy, lowering the quality of life for the patient. Because of the effects of the main illness, additional health problems may emerge. If the condition is not treated or is not brought under control, the symptoms might grow so severe that they threaten the patient's life. There is a risk that the person's health will deteriorate to the point that organ failure, serious complications, or death will occur. It's crucial to remember that the rate at which symptoms worsen varies greatly amongst individuals, both in terms of their underlying ailment and their own unique circumstances. The progression can be slowed and the prognosis improved with early diagnosis and treatment. Chapter 4. Methods of diagnosis. The first step is usually a thorough physical examination and medical history review by a doctor. Potential risk factors, alcohol use, and hepatitis virus exposure will all be discussed. Abdominal distension, jaundice, or an enlarged liver or spleen could be found during a physical examination. Next, blood tests will be used to evaluate liver function and pinpoint the root of the cirrhosis. Liver enzyme testing, AST, ALT, ALP, bilirubin tests, albumin tests, and coagulation investigations are all routinely performed. Abnormal results may indicate liver disease or dysfunction. The diagnosis of cirrhosis relies heavily on the use of medical imaging. In many cases, ultrasonography serves as the initial diagnostic tool. It's sensitive enough to pick up on ascites, a buildup of fluid in the abdominal cavity, liver enlargement, and changes in liver texture. More in-depth images of the liver, such as those provided by CT scans or MRI, can also be used to evaluate the severity of cirrhosis and spot consequences, including portal hypertension and liver nodules. A liver biopsy may be conducted if further diagnosis is required. To take a tissue sample from the liver, a tiny needle is inserted into the organ. After collecting the sample, doctors can analyze it under a microscope to diagnose cirrhosis and rule out other possible causes of liver damage. An accurate diagnosis of cirrhosis, determination of the disease's stage and severity, and development of an effective therapy plan suited to the patient's needs can all be achieved through the integration of data from clinical evaluation, blood tests, medical imaging, and liver biopsy. Better outcomes and the avoidance of future issues can be achieved by early diagnosis and intervention. After a diagnosis of cirrhosis has been made, efficient management of the disease is paramount in halting its progression and avoiding consequences. Cirrhosis treatment options might vary by both the etiology, cause, and severity of liver damage. The first step in treating alcoholic cirrhosis is helping the patient stop drinking. This is crucial because it will stop the liver from being damaged future and give a chance to heal. Cirrhosis caused by viral hepatitis may respond to antiviral treatment, which helps bring the virus under control and lessens liver inflammation. Portal hypertension can be treated with medication, as can variceal hemorrhage prevention and ascites management. In order to reduce abdominal fluid buildup, people with ascites are often advised to follow a low-sodium diet. When cirrhosis progresses to an advanced stage and the liver's function is significantly impaired, a liver transplant may be the only treatment option left. Those who have advanced cirrhosis who undergo a transplant have a better probability of survival and a higher quality of life. Modifications to one's way of life, in addition to conventional medical treatment, are essential in the management of cirrhosis. Patients are frequently urged to eat healthily, exercise frequently, abstain from alcohol and illegal drugs, and adhere strictly to their treatment plans. Hepatitis A and B vaccinations are also recommended to prevent further damage to the liver. Cirrhosis must be monitored on a regular basis in order to follow its progression and detect any consequences early on. Appointments with healthcare providers, such as a hepatologist or gastroenterologist, to check in on a patient's progress and make any necessary adjustments to treatment are essential. It's crucial to keep in mind that cirrhosis is a long-term condition that calls for constant care. Patients with cirrhosis can greatly improve their prognosis and quality of life by following their doctor's orders for treatment, medication, and lifestyle modifications. Patients can greatly benefit from having the support of their loved ones and medical professionals as they work to manage the difficulties associated with this condition and enhance their quality of life. Patients and their families can benefit greatly from the emotional support and education provided by support groups and counseling. It can be comforting and enlightening to hear the stories of others' experiences with the same or similar difficulties. How early diagnosis improves treatment success rates. Treatment success and long-term prognosis for those with liver cirrhosis can be greatly enhanced by catching the disease early. With cirrhosis, scar tissue gradually replaces good liver tissue, impairing liver function over time. There is a window of opportunity to act and adopt successful treatment techniques for cirrhosis, and early detection is key. The underlying cause of cirrhosis can be determined and treated if detected early. Early diagnosis of the underlying cause of liver impairment allows for more targeted treatment that is more likely to be effective in reversing the disease. The ability to monitor patients closely and identify issues early on is another benefit of early cirrhosis diagnosis for healthcare practitioners. Those with cirrhosis are more likely to develop complications like ascites, abdominal fluid buildup, hepatic encephalopathy, brain dysfunction due to liver failure, variceal bleeding, bleeding from enlarged veins in the esophagus or stomach, and hepatocellular carcinoma, liver cancer. When these issues are detected early through monitoring, they can be treated more effectively and with fewer adverse effects on the patient. The ability to educate patients about lifestyle changes is a major benefit of early detection, which complements medical therapies. Adopting a nutritious diet, keeping up with a regular exercise routine, and not drinking alcohol are all important aspects of controlling cirrhosis and preventing its progression. Patients are more likely to make the positive lifestyle adjustments that can have a major influence on their health and liver function if they are made aware of their problem at an earlier stage. Early diagnosis also has the potential to increase available therapy choices. Individuals with severe cirrhosis may be candidates for a liver transplant. before the disease progresses to the point where a transplant is no longer possible. Early identification enables a timely evaluation of eligibility and decreases the risk of complications. Early diagnosis of liver cirrhosis can aid in spreading information about the importance of maintaining liver health and encouraging the adoption of preventative measures. Early detection and diagnosis of cirrhosis allows medical professionals to inform patients and the public about preventative measures. New diagnostic methods for liver disease. Emerging technology have revolutionized medical practices, and these advancements have allowed for optimistic progress in the diagnosis of liver illness. Non-invasive imaging techniques are at the forefront of these advancements because of their importance in the diagnosis and prognosis of liver diseases. Transient elastography, fibroscan, magnetic resonance elastography, MRI, and ultrasound have all contributed to less intrusive diagnostics. There is great promise in the early detection of liver illnesses thanks to the development of molecular biomarkers. Several biomarkers, including microRNAs, circulating tumor cells, and exosomes, have been developed by researchers to detect liver illnesses at an earlier stage than traditional diagnostic procedures. These biomarkers are useful for tracking the success of treatments and the development of a disease over time. AI and machine learning have been included into the diagnosis of liver disease, allowing for the rapid and precise analysis of massive volumes of patient data. Human clinicians may miss tiny patterns and trends, but AI systems can pick them up, allowing for more individualized and successful treatment. The precision and speed with which liver disease can be diagnosed has been greatly enhanced by AI-driven diagnostics, which process data from several sources, such as imaging studies, blood tests, and patient histories. The development of wearable health technologies that permit constant monitoring of patients during their daily lives has further influenced the diagnosis of liver disease. For the purpose of early diagnosis of prospective liver difficulties or monitoring patients with pre-existing conditions, these devices can assess numerous physiological indicators, such as heart rate, blood pressure, and liver-specific enzymes. Genomic advancements in the field of medical genetics have allowed the isolation of particular variants associated with a wide range of liver disorders. The relevance of genetic testing in identifying susceptibility to liver diseases has grown in recent years, as it allows for early diagnosis and individualized treatment approaches based on each patient's genetic profile. Liver disease diagnosis has also benefited from telemedicine and other forms of remote health care. Patients in rural or underserved areas can get the care they need from specialists without leaving their communities, thanks to video consultations and online clinics. Patients who have to be closely monitored due to chronic liver illnesses have benefited greatly from this development. The integration of these cutting-edge technology has been crucial in unraveling the mysteries of liver illness. The pathophysiology of many liver disorders can be better understood with access to more thorough data, which allows for in-depth studies. Chapter 5. Treatment. The method of treatment for cirrhosis rely on the underlying cause and degree of the disease. It is important to treat the underlying cause of cirrhosis in addition to its symptoms and complications in order to restore and maintain liver function. That if cirrhosis is due to alcohol abuse, then putting an end to your alcohol consumption is one of the best things you can do for your liver. Antiviral drugs are used to treat cirrhosis caused by viral hepatitis. These medications inhibit viral replication, which in turn decreases inflammation and facilitates the liver's recovery. Immunosuppressant drugs are used to reduce the body's immunological response to the liver in cases of autoimmune hepatitis. Changes in nutrition, physical activity, and alcohol use are some of the lifestyle adjustments that can help prevent the progression of NAFLD and NASH to cirrhosis. It's possible that you'll need to take medication to manage your diabetes and cholesterol levels. If cirrhosis is the outcome of a genetic illness, the patient may require treatment that is unique to that disorder. Cirrhosis complications, including ascites, abdominal fluid accumulation, hepatic encephalopathy, cognitive impairment related to liver failure, and variceal bleeding, bleeding from enlarged blood vessels in the esophagus, need individualized treatment plans. Treatment options for ascites include reducing sodium intake, using diuretics, or undergoing a paracentesis, fluid drainage. Medication that lowers blood ammonia levels and protects brain function can be used to treat hepatic encephalopathy. Medication to stop the bleeding, ligation of the blood vessels with a band, or, in severe situations, the creation of a transjugular intrahepatic portosystemic shunt tips to shift blood flow and relieve pressure on the varices are all viable options for treating variceal bleeding. Patients with advanced cirrhosis and irreparable liver damage often have only one option left: a liver transplant. Liver transplantation provides the possibility of a new liver and better health. Effective management of cirrhosis and prevention of consequences require constant monitoring, follow-up appointments, and attention to medical instructions. The fundamental goal of treatment is to maintain or enhance liver function and overall health, although specifics vary from patient to patient depending on the etiology, stage, and severity of cirrhosis. If a patient is experiencing weakness or exhaustion as a result of issues connected to cirrhosis, physical therapy may be advised to assist increase muscle strength and mobility. Cirrhosis can have a profound effect on a person's psychological and emotional health. Therefore, receiving support in these areas is crucial. Patients and their families may benefit from counseling or support groups as they deal with the challenges of living with a chronic liver ailment, including the possibility of changes to their lifestyle and the unpredictability of the disease. Patients may require hospitalization for acute exacerbations or consequences, depending on the severity of their disease. Staying in the hospital permits more thorough examination, rigorous treatment, and timely action. Also, modifying one's way of life can be a powerful tool in the management of cirrhosis, especially for people in the early stages of the disease or who have responded well to treatment. The disease's course can be slowed and liver function improved by adopting a healthy lifestyle, avoiding alcohol and harmful habits, and taking prescribed drugs as directed. It is also important to teach people how their personal decisions and risk factors can affect their liver function. Essential elements of cirrhosis prevention and management include encouraging regular exercise, maintaining a healthy weight, and avoiding excessive alcohol intake. Due to the degenerative nature of cirrhosis, patients require constant monitoring and care. Depending on the course of the disease and the patient's response to treatment, the treatment strategy may change over time. Care following a liver transplant is essential for the patient's recovery and the survival of the transplanted organ. Preventing the body's immune system from rejecting a liver transplant often requires lifelong immunosuppressive medicine. Medical professionals collaborate closely with patients throughout care to address any specific issues that may arise. To ensure that patients are aware of their disease, treatment options, and the significance of sticking to recommended drugs and lifestyle adjustments, open communication and patient education are crucial. Appointments with a hepatologist or gastroenterologist for follow-up care are essential for tracking treatment progress and catching problems in the early detection stages. These checkups also give patients a chance to report any new symptoms or concerns and have their treatment regimen adjusted accordingly. Symptom management, enhancing the patient's quality of life, and reducing complications become the primary goals when the underlying cause of cirrhosis cannot be addressed, as is the case in certain genetic disorders. Patients who have advanced cirrhosis or who are not good candidates for a liver transplant may benefit from the introduction of palliative care. To improve a patient's quality of life at the end of life, palliative care focuses on reducing distressing symptoms, controlling pain, and providing emotional support. Patients with cirrhosis might benefit greatly from having the emotional support of family, friends, and support groups in addition to medical treatments and adjustments in lifestyle. Individuals with cirrhosis require individualized care programs that take into account their specific symptoms and severity of the disease. The prognosis and course of treatment for cirrhosis can be greatly improved with accurate and prompt diagnosis and prompt, continuous care. Drugs, surgery, and liver transplants. Antibiotics are frequently used for the treatment of acute infections due to bacteria. Antiviral drugs, on the other hand, are used to treat viruses like influenza and HIV. In severe cases, analgesics or opioids are utilized, while nonsteroidal anti-inflammatory medications, NSAIDs, are used for illnesses like arthritis to alleviate pain and inflammation. Long-term pharmaceutical regimes are commonly used to manage symptoms and prevent consequences from chronic diseases like hypertension, diabetes, and heart disease. Depending on the cause and the patient's response, the drugs in this category might range from beta blockers and ACE inhibitors to diuretics and insulin to oral hypoglycemic treatments. When conservative methods of treatment have failed, surgical intervention is usually the next best option. Endoscopies are an example of a minimally invasive surgery. Patients with organ failure have the option of receiving a new organ through a transplant. In cases of severe liver illness, such as those caused by chronic disorders like cirrhosis or sudden liver failure, a liver transplant may be necessary. In a transplant procedure, a healthy liver from a deceased or living donor is surgically implanted in place of the diseased liver. Immunosuppressive drugs must be used for the rest of a patient's life to prevent organ rejection. Breakthrough treatments have become possible thanks to recent developments in medicine and science. For instance, gene therapy has the ability to cure incurable genetic illnesses by correcting defective genes. Medicine and surgery have come a long way, and organ transplantation has saved countless lives. These treatments have changed the face of contemporary medicine, saving and improving the lives of countless people around the world. Future holds even more exciting and novel strategies to enhance global health outcomes as medical knowledge continues to grow. Stem cell therapy, an integral part of regenerative medicine, has enormous therapeutic promise. Researchers in the medical field are hopeful that they can mend damaged tissues, stimulate organ regeneration, and possibly treat incurable diseases by employing undifferentiated cells capable of growing into specialized cells. Precision medicine is another cutting-edge field since it allows doctors to personalize therapies for each patient based on factors such as their genetics, lifestyle, and environmental factors. By identifying genetic markers that may affect a patient's response to various pharmaceuticals, genetic testing paves the way for individualized treatment strategies that can improve efficacy and reduce adverse effects. Advantages, disadvantages, and constraints of each therapy option. Adjustments to your way of life. Although there is a low risk associated with making lifestyle changes, some individuals may struggle to give up things like alcohol and certain foods. The benefits of making these adjustments include a slower course of cirrhosis and enhanced health. Lifestyle changes may not be enough to reverse advanced cirrhosis on their own, and their efficacy varies according to the severity of the disease and the individual's adherence to treatment. Medications. Some medications may have unwanted side effects or interact badly with other medications the patient is already taking. Antiviral medications for viral hepatitis, for example, can do more than only reduce viral replication in the body. They can also reduce inflammation and enhance liver function. Unfortunately, treatments may only be able to alleviate symptoms rather than completely reverse cirrhosis. Transplantation of the liver. Major surgery is required for a liver transplant, and there is always a chance that the body would reject the new organ, requiring lifelong immunosuppression. IT gives patients with end-stage cirrhosis a second chance at life by giving them a healthy liver and increasing their chances of living for a long time. Not all patients are eligible for a transplant, and there is a limited supply of organs. The operation is also very expensive and requires ongoing medical care and medicines. Palliative medicine. Palliative care's emphasis on symptom management means it may not slow cirrhosis's progression, but IT helps by relieving suffering and providing comfort and solace to the patient. Palliative treatment has limitations in that it is not a cure for cirrhosis and does not address its underlying causes. Clinical research and new treatments. Patients participating in clinical trials have the opportunity to try out novel treatments before they are generally available to the general public. The success of experimental treatments may not be fully recognized in the long run, and not all patients are suitable for clinical trials. The treatment of cirrhosis is a complex and evolving process that may involve a number of different modalities throughout the treatment. In order to adjust the treatment plan based on the patient's response and changing circumstances, close monitoring of the patient and close collaboration between the patient, healthcare providers, and specialists are essential. Patients with cirrhosis should take an active role in their treatment and keep an open line of communication with their doctors. This includes strictly adhering to any and all drug regimens, food restrictions, and other recommendations made by your doctor. Monitoring liver function, spotting problems, and making required treatment adjustments all necessitate routine checkups and laboratory testing. Chapter 6. Modify your habits. Maintaining a healthy liver begins with eating well. Fatty liver disease can be prevented in part by reducing consumption of liver-taxing processed meals, sugary drinks, foods high in fat, and fried foods. Maintaining a regular exercise routine is also essential for liver health. In addition to aiding in weight management, maintaining a regular exercise routine increases insulin sensitivity and decreases the likelihood of developing fatty liver disease. Avoiding heavy alcohol use is crucial for liver health. Diseases like alcoholic liver disease can be directly attributed to alcohol abuse. If you want to keep your liver healthy, you should limit or eliminate your alcohol consumption. The liver is vulnerable to damage from a number of treatments and substances. When taken in large doses, over-the-counter pain medications like acetaminophen can cause liver damage. If you have a pre-existing liver issue, it is very important to carefully follow the dose instructions and talk to your doctor before starting any new medications or supplements. Keeping a healthy weight is just as important for liver health as making dietary and lifestyle adjustments. The development of NAFLD can be influenced by obesity and the buildup of extra body fat. You can lower your risk of NAFLD and help your liver operate better if you eat right and exercise often. Keeping diabetes and high blood pressure under control can also help the liver. If not treated, these disorders can have harmful effects on the liver and could cause problems. Liver load can be lightened and the risk of liver-related problems reduced by following a treatment plan and adopting a healthy lifestyle. Reducing stress can have a major beneficial effect on liver function. Stress hormones released in response to prolonged stress have been linked to liver damage and inflammation. Meditation, yoga, deep breathing exercises, and time spent in nature are all great ways to reduce stress and boost liver health. The importance of getting enough sleep to maintain a healthy liver is frequently overlooked. The liver is one of the many tissues that the body heals and regenerates as you sleep. Maintaining a sleep schedule of between 7 and 9 hours per night has positive effects on liver function. The health of your liver can be improved by eating meals that are good for it. Detoxification is aided and liver regeneration is encouraged by substances found in foods like garlic, turmeric, beets, and leafy greens. The health of your liver can be improved by including these foods in your diet on a regular basis. If you want a healthy liver, you should also quit smoking. When a person smokes, toxic substances enter their circulation and must be filtered out by the liver. Quitting smoking is an essential step towards promoting liver health since it reduces the risk of liver disease and improves liver function. The best way to keep tabs on your liver and catch any problems in their earliest stages is to get checked and screened regularly. By analyzing your blood for anomalies or indicators of liver damage, your doctor can determine your liver enzyme levels and other markers. Participating in extracurricular activities and establishing a solid network of support can have a beneficial effect on liver health. Keep in mind that the positive effects of a change in lifestyle on liver function may not become immediately apparent. Consistency is vital and modest. Long-term efforts can yield significant results. If you have any pre-existing liver diseases or health concerns, you should always talk to your doctor before making any major changes to your lifestyle. The benefits of prioritizing liver health and adopting these changes in your lifestyle extend far beyond the liver itself. It's possible that your digestion, mental acuity, and energy levels will all improve. The chance of acquiring other chronic health disorders may also decrease, and you may find it simpler to keep a healthy weight. It's important to keep your patience and enthusiasm up as you make these great adjustments. It takes time and determination to alter one's behavior and embrace a new way of living. Acknowledge your progress and focus on the big picture because improving your liver health will pay dividends for years to come. It can be helpful to find a group of people who share your dedication to improving your liver health, whether that's in real life or online. You can gain inspiration, motivation, and perhaps even some new ideas to adopt into your daily life by listening and learning from the experiences of others. Keep in mind that your experience is unique, and the things that help you may not help someone else. Keep an open mind as you experiment with different ways to find what works for you. The trick is to establish a regimen that you will look forward to following and be able to keep up with over time. Keep track of any improvements in your health and bring them up in conversation with your doctor at your next appointment. They are in a position to provide supplementary direction, keep an eye on your liver's condition, and make necessary alterations to your health management strategy. The significance of treating related health issues simultaneously. Some people with cirrhosis usually have diabetes, a chronic condition characterized by high blood sugar levels. Cirrhosis, which affects the liver and its ability to regulate glucose, can worsen diabetic symptoms. Cirrhosis can worsen if the diabetes that causes it isn't well treated. Therefore, it is crucial to keep blood sugar levels under control by medication, dietary alterations, and regular monitoring in order to lessen the risk and keep general health in good shape. Obesity is a major risk factor for cirrhosis and is commonly associated with the onset of fatty liver disease. Liver function can be impaired by excessive fat accumulation due to inflammation and scarring. Obesity has been linked to a hastening of cirrhosis's advancement and an increase in the prevalence of liver problems in people who already have the illness. Therefore, it is crucial in the management of cirrhosis to take a holistic approach to weight control, which includes a balanced diet, frequent physical exercise, and behavioral adjustments. Multiple health disorders coexisting with cirrhosis present unique challenges that can only be addressed with medical supervision and specific treatment programs. The cornerstones of this management approach include routine checkups, blood parameter monitoring, and medication modifications as needed. In order to ensure that diabetes, obesity, and cirrhosis treatments do not interfere with one another, healthcare professionals must work closely together. Modifying one's way of life, in addition to receiving medical treatment, is essential for controlling cirrhosis's associated diseases. The long-term prognosis and general health of patients can be improved by encouraging them to adopt healthier behaviors, such as stopping smoking, lowering alcohol intake, and maintaining a healthy, balanced diet. As a result, people with cirrhosis of the liver must take special care to manage any other health problems they may have, especially diabetes and obesity. Improved liver function, decreased risk of complications, and enhanced quality of life for persons living with this complicated and demanding disease are all possible when these problems are addressed holistically by healthcare experts. Comorbidity management in cirrhosis requires attention to education and patient agency. Healthcare providers can encourage patients to take an active role in managing their health by teaching them about their diseases, the significance of adherence to medications, and changes to their lifestyle. There is no universal method for treating cirrhosis patients with many medical issues. Care plans must be individualized to each patient based on their specific conditions, medical history, and other factors. As problems vary over time, it may be important to periodically reevaluate and adjust treatment procedures. Chapter 7. Managing Emotions. The diagnosis is the beginning of a long, emotional journey for patients. The diagnosis of cirrhosis can be upsetting, as it forces the patient to face their own death and the difficulties of their future. Knowing that their illness may worsen over time causes ongoing fear, anxiety, and uncertainty. The mental toll of constant exhaustion, jaundice, itching, and discomfort is significant. The restrictions placed on their capacity to perform normal activities only serve to increase their sense of powerlessness and frustration. Patients may eventually need to undergo hospitalization, medical procedures, and perhaps a liver transplant as the disease worsens. Feelings of helplessness are sparked by these events, causing people to wonder about their future and quality of life. Being unable to work or participate in social activities on a consistent basis, along with the unpredictable course of the disease, can leave sufferers feeling isolated and depressed. The emotional toll is felt by everyone in the family. As a result of seeing their loved ones suffer physically and emotionally, family and friends may experience an increase in feelings of helplessness and grief. They may feel emotionally tired and pulled between their responsibilities and their own needs as a result of taking care of another person. Due to the unknown nature of cirrhosis, families are constantly on edge. The constant worry that the sickness will worsen or cause complications causes them to keep a close eye on the patient. Roles and obligations within a family may also change as a result. The caregiver may struggle with conflicting priorities between their care for the patient and their own health and happiness. There may be an emotional tug-of-war between the want to be helpful and the need to face the hard reality of the condition for the patient's siblings, parents, or children. Patients and their loved ones may carry the additional emotional load of guilt. Both patients and family members may suffer guilt while dealing with the emotional toll of providing care for a loved one with a chronic illness. It might be difficult to have frank discussions about the sickness and its repercussions within the family. Because of this, emotional toll might be compounded by misunderstandings and disagreements that go unsolved. The emotional toll that cirrhosis takes on patients and their loved ones cannot be overstated. A complicated emotional landscape is formed when physical symptoms and unknowns combine with feelings of fear, anxiety, guilt, and powerlessness. Patients and their loved ones need to seek out emotional support, counseling, and resources to help them deal with the emotional issues that this disease presents on a daily basis. Patients and their families struggling with the emotional toll of cirrhosis would do well to seek out emotional assistance and resources. A secure place to talk about feelings, get advice, and learn from others in the same boat is something you can find through support groups, counseling services, and patient advocacy organizations. In order to cope with the mental and emotional burdens associated with their illness, patients must keep an open line of contact with their medical team. Some of the anxiety and uncertainty they feel can be reduced if they have a firm grasp on their disease, available treatment options, and likely consequences. Keeping in touch with medical staff also helps patients get the emotional support they need and learn about community services for mental health. Patients and their loved ones can benefit from a shared understanding of cirrhosis and its treatment by becoming more involved in decisions about care. Learning as much as possible about a patient's condition and the available treatment options might help them feel more in control of their health care and lessen their fear of making decisions. Patients and their loved ones can benefit from emotional coping strategies like mindfulness practices, meditation, and relaxation exercises. Despite the difficulties they experience, people may find some measure of peace and serenity through these methods. If you're having trouble dealing with the emotional toll, talking to a counselor or a therapist can assist. Counseling can help patients deal with the emotional difficulties of their diagnosis by providing a safe environment for them to voice their fears and concerns, learn coping skills, and talk about treatment options. Family counseling can help improve communication, boost coping mechanisms, and smooth out the bumps in the road of caregiving. Patients and their loved ones might benefit emotionally from taking part in activities that bring them joy and fulfillment, despite the constraints imposed by the sickness. Moments of relief from the burden of cirrhosis can be found in hobbies, spending time with loved ones, and attending support group events. Patients and their loved ones dealing with the emotional stress of cirrhosis should learn to practice self-compassion and empathy, recognizing that it is okay to feel helpless, unhappy, or anxious at trying times will lighten the load of guilt that often accompanies these feelings. Patients can benefit from self-compassion by being mindful of their own feelings, accepting that they are dealing with an unpleasant illness, and refraining from placing blame on themselves. Individuals with cirrhosis can improve their emotional resilience by prioritizing self-care and tending to their physical and mental health. When people in a family are able to talk to one another about their feelings and concerns in an accepting and understanding environment, everyone benefits. Many people have found it beneficial to talk to their loved ones about their worries and concerns throughout medical procedures. By talking things out, you may clear the air of any confusion or stress and boost morale all around. Patients and their families may benefit from palliative care or hospice treatments as cirrhosis advances. These expert groups are well-versed in giving all-encompassing assistance with an eye towards bettering patient quality of life and alleviating their ailments. These services can be of great help to people as they move through this trying time by putting an emphasis on their comfort, dignity, and emotional well-being. Patients and their loved ones dealing with cirrhosis would also do well to remember the importance of enjoying the little things in life. Recognizing and appreciating the positive experiences can help counteract some of the emotional obstacles, whether it's a good day with reduced symptoms, a successful medical checkup, or a passionate moment shared together. Getting some time off from caring for a loved one is not a sign of abandonment, but rather an act of self-care. In order to maintain their own emotional health, carers can benefit from accepting assistance from others, such as friends, family, or professional caregivers, dealing with stress, anxiety, and depression. Get in touch with loved ones or people in a support group who can listen and understand your situation. Telling someone about how you're feeling and what you've been through might lighten the load and make you feel less alone on your path. Self-compassion is similarly crucial. Keep in mind that cirrhosis is a medical disease and in no way reflects on your character. Avoid harsh self-criticism and treat yourself with kindness. Recognize that it's okay to experience temporary feelings of being unable to cope and give yourself time to recover. A great way to alleviate stress and unease is to practice relaxation techniques. Calming practices like yoga, meditation, or deep breathing can help you deal with stress and difficult emotions. It can also help strengthen your mental and emotional fortitude via consistent training. Maintain your liver health and your body's overall well-being by eating a diet rich in nutrients and low in sodium. Feel-good endorphins can be released with regular exercise, provided you get your doctor's permission. Establish a schedule that incorporates enjoyable and satisfying activities. Positivity can be diverted and feelings can be released through the pursuit of hobbies, interests, and creative activities. Learn as much as you can about cirrhosis and how it's treated. By giving you the tools to make educated decisions about your health, knowledge about your situation can help ease your worries. Talk to your healthcare providers about any questions or doubts you have so that you may rest easy. Managing cirrhosis and its psychological repercussions requires cutting down on alcohol consumption. Alcohol consumption has been linked to increased liver damage, as well as increased levels of depression and anxiety. Instead of drinking, try to develop positive ways to deal with stress. Never feel bad about needing assistance. Don't be afraid to rely on your friends, family, and medical professionals for help when you need it, whether it's with day-to-day tasks or emotional support. Take care of yourself first and foremost, and don't be shy about asking for help when you need it. Cirrhosis of the liver can be emotionally taxing, but with time and effort, you can learn to cope with these difficulties. To help you deal with the effects of cirrhosis, you may choose to engage in pursuits that give your life meaning and direction. You can feel more connected to your community and gain a sense of purpose by volunteering your time, joining a support group, or advocating for better liver health in your area. It's important to keep an eye out for cognitive distortions and negative thought patterns that can crop up when dealing with the difficulties of cirrhosis. In order to overcome these cycles and adopt a more beneficial style of thinking, cognitive behavioral therapy, CBT, can be of great assistance. Expect to feel a wide range of emotions as your experience unfolds. It's normal to feel overwhelmed occasionally. It's acceptable to seek professional help or make adjustments to coping skills. And remember that healing and emotion management are processes that take time. Using artistic mediums like writing, painting, or music might help you work through your feelings and find some peace. Participating in creative activities can be a healthy way to release pent-up emotions and gain perspective. Think about starting a daily gratitude practice in which you give thanks for all the blessings in your life. Showing appreciation for the blessings in your life and the help you've received has been shown to increase people's resilience and encourage a more positive approach. Keep a journal to record your thoughts as you face the difficulties. Writing down your thoughts and feelings might help you understand them better and monitor your development over time. It's a chance to let out some negative feelings and acquire some perspective. Do not judge your progress against that of others. What helps one individual with cirrhosis may not help you the same way. Find methods of dealing with your problems that fit in with who you are and what you value. The need of support networks. People living with cirrhosis of the liver can greatly benefit from the guidance and solace that support groups provide. Cirrhosis is a chronic, sometimes fatal disease that can put a heavy emotional toll on patients and their loved ones. Individuals can feel comfortable discussing their struggles, anxieties, and doubts within the context of these support groups. Patients with cirrhosis can find acceptance and understanding from others going through similar experiences at these gatherings. A strong sense of community and emotional support can develop as members share helpful information about managing symptoms, treatment alternatives, and coping skills with one another. Meeting with a support group can provide a safe space to talk about difficulties and learn from others' experiences in adjusting to change. As a result, patients will have a greater sense of control and will be able to adapt to the adjustments that are essential to their health. Chapter 8. Promoting good liver health. Adopting a healthy lifestyle is the first step in lowering your chances of developing cirrhosis. Because excessive alcohol consumption is a major cause of cirrhosis, Reducing or eliminating it is crucial. If you choose to drink alcohol, do it in moderation, and get help if you have a problem with alcoholism. The liver can be kept in good condition by eating a diet high in fruits, vegetables, whole grains, and lean proteins. Improving liver health is also aided by consuming less processed and fatty meals. Regular exercise is helpful for keeping a healthy weight, which is important because being overweight raises the chance of developing cirrhosis of the liver. It is also important to exercise caution when taking medications and supplements, adhering to recommended dosages, and avoiding drug combinations that could be harmful to the liver. If you have a history of liver illness or impairment, you should talk to your doctor before starting any new drugs or supplements. Cirrhosis risk can be drastically decreased if the spread of viral hepatitis is stopped. Safe sexual practices, not sharing needles, and properly sterilized medical equipment are all crucial preventative measures. Hepatitis A and B vaccines offer protection against these viruses if you get immunized. Pre-existing conditions must be monitored and managed. Diabetics, hypertensives, and those with elevated cholesterol levels should coordinate their care with a medical professional. Cirrhosis risk is increased when chronic illnesses are not treated effectively. If you want to keep your liver healthy, you need to avoid toxic chemicals and several household cleaning products. When working in potentially toxic situations, it is important to take precautions such as wearing protective clothing and equipment. In order to recognize and treat liver problems as soon as possible, regular doctor visits are crucial. Liver function tests should be performed routinely so that any issues can be addressed quickly. It is crucial for people to understand their own genetic predispositions and family history in regards to liver health. People with a family history of liver disease or cirrhosis should let their doctors know and get frequent screenings and testing to monitor their liver health. Managing stress is another often overlooked but crucial component of liver health. Liver damage is made worse when people with chronic stress turn to unhealthy coping techniques like excessive drinking or drug use. Stress can have negative effects on your health and happiness, but using relaxation techniques like mindfulness, meditation, or hobbies might help. Individuals should consult trusted resources and medical specialists to keep educated about liver health. Knowing the symptoms of liver illness can help in its early diagnosis and prompt treatment. Jaundice, a yellowing of the skin and eyes, abdominal pain, unexpected weight loss, and extreme weariness are all common indications of liver disorders. When dealing with health issues, it's important to avoid treating yourself and instead consult a doctor. It is possible for people to cause permanent damage to their livers by attempting to self-diagnose and treat minor symptoms. When used incorrectly or in combination with other chemicals, even medicines available over the counter can have harmful consequences on the liver. Therefore, it is crucial for liver safety to speak with a medical practitioner before beginning any new medicine or supplement. People need to be wary of how much pollution and chemicals they let into their bodies. There may be a higher risk of injury to the liver from exposure to certain drugs in certain professions or surroundings. Potential liver damage can be mitigated by taking the necessary precautions, including protective gear and limiting exposure to pollutants. Liver donation and transplantation. Donating organs and receiving liver transplants are two interrelated medical procedures that have come to the forefront in recent years. At the heart of this expanding comprehension is the realization of the radical potential of these procedures to save countless lives and enhance the quality of life for untold numbers of people. The critical shortage of organs is largely responsible for the recent uptick in public discussion of organ donation. Patients with a variety of illnesses, injuries, and birth defects often face the tragic reality of organ failure. Those whose survival depends on locating a suitable organ donor have a glimmer of hope in organ transplantation, particularly liver transplantation. Due to its several important roles, liver transplantation stands out as an essential medical treatment. The liver's primary functions include metabolism, protein synthesis, and detoxification. Complications from liver failure can be fatal, leaving transplantation as the only option for many patients. The rising incidence of liver illnesses including cirrhosis, hepatitis, and liver cancer has only served to highlight the value of liver transplantation in contemporary medicine. The practice of organ donation has also gained more public attention. There are fewer stigmas and less questions now that people have a better grasp on what causes brain death and how organs can be donated after death. Donating an organ is now widely recognized as a selfless deed that gives individuals in need a second chance at life. The success rates and long-term results of liver transplantation have increased thanks to developments in medical technology, surgical procedures, and post-transplant care. The public's trust in organ donation procedures has been enhanced as a result of these advancements. The ethical implications of organ donation and liver transplantation have also contributed to the rise in public interest in these topics. The idea that one person's devastating loss might lead to another's salvation is a powerful incentive for organ donation advocacy, and the concept of giving the gift of life, even in death, resonates emotionally with many individuals. The benefits of organ transplantation are not limited to the recipients and their loved ones. The culture of compassion, understanding, and unity it fosters spreads like a wave across society. Donating an organ is a powerful symbol of the goodness that may be found in people and of our basic desire to aid those in need. It is hoped that waiting lists for organs will decrease and more lives can be saved as education about organ donation and liver transplantation spreads. This realization has been propelled forward by the involvement of the government, cooperation amongst healthcare institutions, and partnerships with nonprofit organizations. Medical practitioners, nurses, and transplant coordinators all play a vital role in public education campaigns, spreading the word about organ donation and dispelling common misconceptions. The efficiency of the organ allocation procedure has also been improved because of the creation of national and international transplant registries, where donors and patients can be matched. Organs can reach recipients faster thanks to these registries, and the transplant window can be extended with the help of advances in transport and preservation methods. The future of organ transplantation is bright, thanks to the commitment to research and innovation. Overcoming organ shortages and completely revamping the transplant procedure could be possible because of developments in regenerative medicine, tissue engineering, and xenotransplantation.